You know, it's well known in communication that it's not always what you say, but it's how you say it. And that applies to our relationship with our friends, our relationship with our colleagues, and our relationships with our patients. So when we go in to talk to a patient, it's important to think about the interplay between our verbal and our nonverbal behavior. What do we know? We know that the Therapeutic Alliance is stronger between clinician and patient when the clinician really listens, when the clinician asks pertinent questions based on what the patient just said, not a list of standard questions that we ask everyone, and that when the clinician shows sensitivity to what the patient complains about. And I'll tell you, there are a lot of patients that come in and think their voice problem is because of postnasal drip, and I might hear that 7 or 10 times a day, and the likelihood of that being true is very small, but I'm sensitive that the patient perceives that. I let them say it, and then I offer other explanations. Have you ever thought about your nonverbal behavior with a patient? You know, the Agency for Healthcare Research and Quality has actually studied this and has courses to teach physicians good nonverbal behavior. I don't know if you've ever noticed, but physicians seem to sit below or often sit below their patients now when giving them the results of tests or an evaluation or even bad news. So they don't come into the room and are standing over the patient, ominous. Let's think about yourself. Let's think about, what does your face look like when you're talking with a patient? How about your stance? Is it opening? Is it open and welcoming? Are your arms crossed? What about the tone of your voice? Is it open, welcoming, questioning, interested? And eye contact. My goodness, we have so gotten into the habit of typing on the computer while the patient's sitting over there talking. Eye contact is the pivotal feature that makes someone believe that you're listening, that you're interested, and that you care. So make sure you're looking at your patients, not at your cell phone, not at your watch, and not at the computer. And lastly, the pace. We're all busy, but every patient deserves our undivided attention. And so think about, do you feel like you're rushing them? Or do you feel like you're giving them the opportunity to tell their story?